Hello, my coding family. How's everybody doing? Sorry I'm late. We had a Pokemon emergency. Literally. Sorry. Let me get TikTok a-rolling. I was sitting here playing around, setting up some practice questions for today, and then I got pulled aside by the boys for a Pokemon emergency. Let me get TikTok set up. How's everybody doing? Good to see you guys. Happy Turkey Day. Happy holidays. I know you're probably going nuts trying to clean your baseboards or get stuff out for cooking tomorrow. All the expectations. How is everybody? Can you guys hear and see me? Hey Go-Kart, hey Mabel, hey JP, hey Alyssa, hey Kanisha, good to see you. Thanks Go-Kart for the reminder. Hey Patil, good to see you. Yay, good. I'm so glad y'all can hear me. All right. How's everybody doing? Let me bring up something. My pen's out of ink. Let me see, do I have, let me get this up. All right. Let me see, where is today's Word document? Do we have this. All right. Awfully little. So I was just going to try to maybe show you guys just a little bit of what we might be doing in Practicode. And for those that don't know, after you get your CPC, if you happen to have an apprenticeship with aapc for your CPC, you can get rid of your apprenticeship with purchasing something called Practicode, which is a way to give yourself experience medical coding, medical charts. AAPC has captured a ton of medical records from real life situations, they say, and they have created a way for you to go into these charts, and they'll let you bring up a claim form and fill it out. And that's what we're doing on Sundays for Practicode Sundays. We're going through the cases, and I'm showing you what their expectations are as far as the answers go. So I brought a case up just to show you guys, just in case also, what if the certification exam for next year in January at some point has a few cases at the end that are not multiple choice, they're fill in the blank. I don't know when they'll do this. They might do it next year. My assumption is if they ever do it, it'll only be the 10 cases at the very end. But it's always good practice just to know, well, what if you didn't have an EA chart system where you could type in the name of the procedure and it pull up a range of codes for you to look for? What if you actually did have to use the book and look for a particular procedure or something? What are you going to do if there was no internet, like the internet went down and all you had was your coding books? What are you going to do? And that can happen from time to time. Internet goes out, once a year, maybe at a medical practice or a hospital, and we have to revert back to paper charts that particular day, and then the next day everything gets keyed in. It'll happen to you at least once in your medical career. So if we were looking at this chart, what is one of the diagnoses that we might have to look up all on our own? And what would be the main term? How would we look it up? Charlotte, you find those in your HipPix book? So hopefully you've got a HipPix book. She asked, where do I find modifiers associated with ABNs? So if you go to your HipPix book, I happen to use AAPC's version of the HipPix book, and modifiers are located in Appendix B. And this will have all the modifiers right there. And I believe the ones for ABN are B, C, D, E, F, G. Now that's CLIA waiver is QW. Which one is it? Is it? I always get them dyslexic backwards. If it's not Q, then it's G. Then G, A, is for our waiver of liability for payers. It's in Appendix B. All your modifiers that are not included in your CPT book, the rest of them are all located in your HitPix book. Appendix B, GA. We should search up the word arthritis. Perfect. So for you guys on TikTok, we happen to have our ICD-10 book out. We're going to go in the front of our book. We're going to look up the word osteoarthritis. Knowing your alphabet is great. And this is slow compared to typing A, B, C, D, E, F, G. Osteoarthritis. We're going to look for which type of osteoarthritis. There's a million of them, right? Arthritis starts with ankle, elbow, foot, and then hand. Most of the time, you're going to go down to primary, the word primary, go to hand, and then we're going to look for the right hand around our M19 area, M19.04. And then we're going to go look for a left thumb. And then we're going to go look for shoulder. Shoulder is also around the M19, going to be around M19.01 area. And that's just on down to shoulder. And then you'll go to your tabular list to those, and then we'll make sure that we capture the correct ones. So M19, be sure to stop off at your M19, the first 3 digits, because if there's any guidelines you need to know about it, they'll be posted here. M1904 is where you find your primary osteoarthritis of the hand. Then we just need to pick out the correct hand. Right hand is 041. Also, if you're stopping off at the first 3 digits, if the code requires a 7th character, it will be listed there. So this one doesn't require a 5th digit, so probably this one would end up being M19.041. It's primary diagnosis. And then left thumb is going to be where? Where would you find left thumb? If we were looking in our alphabetical index, we're still under our osteoarthritis somewhere. We won't be looking under hand, right? What is a thumb? What is a thumb? What would we be looking under? Not ankle, not elbow. Those fancy words for the hand. Carpio metatarsal. Yeah. That's going to take us to our M. Could not find that one they wanted. The M, if you look in the front under osteoarthritis, you do have the under the hand joint, first carpometacarpal, it tells you M18.9. So let's go to M18. Let's see if there's anything. M18 says first metacarpal joint. What would be our thumb? One is unilateral primary osteoarthritis, first metacarpal joint. 110 is unilateral. 111 is unilateral first metacarpal joint of the right hand. What if M1812 says unilateral primary osteoarthritis of the first metacarpal joint of the left hand? Because the thumb is the left thumb. So I like M18. M18.12, but I got that from the index telling me to go to M18.9 is what the first index told me, the alphabetical index. And in your CPT book, hopefully you've written in, or you know which finger is what. Where is another CPT for that year? Did I do? Go into that page and marking down which one's first, second, third in this document is super handy dandy. I have notes on that somewhere. And then our other diagnosis is of the right shoulder. Shoulder tells us to go, I already had that down, it was like M19. For the primary shoulder, M19.01 is shoulder, and we need the right shoulder. So M19.001. So we'll get rid of that one. And then the next one is M19.001 or 011, right? Now, how do you do all the CPT codes? Like, what would we look up if we were doing this is really interesting too for you guys that are doing CPC. Even if we're still having fill in the blanks, when you do get a real job out here in medical coding, if by chance you're using a book, this will be helpful. What would we look under in the alphabetical index to find the procedure of a right thumb basilar joint reconstruction with flexor carpi radial tendon reconstruction. What's our main term of that procedure? And that is how you're going to find which CPT code you're going to go. And that's where this index comes in play in the back of your CPT book. No matter which book you've got this index in the back, giving this page a good read about what the main terms are, what the modifying terms mean, what the conventions mean. Super helpful. What is our main term? What are we doing? There's probably a couple of ways you can look this up. Reconstruction. I was thinking about repair. It's a repair, right? If we look under repair, maybe tendon? Don't know. What does reconstruct say? Reduction. Reconstruction. Do we have a tendon? Is that what we did? Yeah, it was a flexor tendon. A reconstruction. Thumb, toe. Do we have a tendon? Do we have a repair tendon? What is the carpal whatever? What body part are we in? We're under wrist. What if we look under just the simple word wrist? And right above it, of course, is the word plasty, which is technically a repair. And then you look under wrist and repair, you get to the 25447 back here in the back of the book. If I just go into wrist and repair, they give you 25447. Let's go to that code and see what's going on in it. 25447. Oh, I done forgot the number. What was the number? 25447. Okay, 2544. 447. When I look at the 25447, before I look at my CPT code and descriptor, I need to back up and I need to look what body part, header, am I doing, making sure that I'm under the right body part heading, right? Over here, I've got humerus, upper arm, elbow, and then the next one is wrist. Good. Then they did an excision of the wrist, introduction, or a repair. We are under repair of a wrist when we're looking at this code, which falls in line with what's going on in the back of the index too. This says it's an arthroplasty, interposition, intercarpal, carpal metacarpal joints. What did we do today? according to our notes, we did a flexor carpial radius tendon reconstruction. You got to know that that verbiage goes along with a certain CPT code without them telling you what the answer is, and knowing that what's going on in this procedure is an arthroplasty, but they're not saying that they did an arthroplasty, right? Being able to match and code things with what it's saying inside the book versus what an op note says they did, and then classifying that as a particular CPT code, oof, that's a whole nother aspect of medical coding later on in this practic code that puts this at a different learning level than just passing the certification exam. So this right thumb joint reconstruction is what an arthroplasty is. Knowing that this flexor carpi radius tendon is located in the wrist, it's another aspect of this. And then matching that up with your CPT code 25447. And then we need a modifier on that one, right? Because that was the right hand. So we need an RT, right? What's our next procedure? Our next one was arthocentesis of the middle finger. That one might be easier to look up, right? We're going to go, why don't we go to arthocentesis? Let's see what shows up for that. We do have arthocentesis down here, ankle, then whatever, ectomy. Then we've got finger and joint. And then interphalangeal, because we did a finger, and it does say interphalangeal joint in there. So that one's a little bit easier. It points you to codes 26860 through 63. 26860. Let's go there. 268. Two, 6, 8. $60 says it's arthocentesis interphalangeal joint with or without internal fixation. And then we just need which finger? Middle finger of the right hand. So we'd probably need some sort of modifier for that. Can we label which finger it is too? And if we're doing a separate procedure, we're probably going to need our '59 modifier, right? We did a distinct different procedure, RT. Right? What other procedure did we do? We check chat. Y'all are probably losing your minds. Hey, yeah, that's arthroplasty is a much simpler term. Yeah, go there too. Arthocentesis. Yeah, maybe you could find it under repair. Bhaskar, y'all could find lots of stuff. Just because the way that I find it isn't the only way. The good thing about having this alphabetical index is that you can find multiple ways about finding them too. The other procedure is we did two injections, but am I missing something? I think I'm missing something. We did a repair. We did the arthocentesis, but didn't we, in here, we did something with something else. So just the joint reconstruction and the tendon, what they ended up doing is they took a tendon from one aspect and they moved it to another area. So they repositioned a tendon, and we need to be able to find that code also. What would we look under? Would we look under reposition? Would we look under what? Let's go see. What have they got underneath the word tendon? Just by chance. Tendon. A, B, C, D. They got tendon. They got lots of tendon stuffs. They've got excisions. Do they have a, they do have a transfer into the wrist or into the, if they transfer it, or transplant it, we're getting a 2, 6, 8, 2, 6, 8. That's our Arthocentesis. We've been there. What about 2, 6? No. Transfer or transplant a tendon in the carpo-metacarpal area without a graft. We didn't do a graft. That's our 26480. And then we're going to need like a 59 modifier, and then which RT2, and then we need the injections. We did 2 different injections in the shoulder and then an injection into the thumb. We should be able to find those easy under probably injection, right? We go to injection. But that's just one case, and this practic code has 600 of these cases for you to do. So if you're gonna bite the bullet and do this, injection, joint, it's telling us to go to 20600. Know what you're getting into. And then some of the answers are incorrect. And you can fill out a form after you submit your answers and ask them to recheck their answers that you think that they don't have the correct answer. They will get back with you with a rationale and correct your answer if they indeed do have an error on it. Arthocentesis, injection in a small joint for the thumb. We're looking for the thumb. The thumb was left thumb. So that is a 20600 with RLT. And then we had the shoulder that was injected, which will not be the small joint. We'll need to move up to a bigger joint. Is that a large joint? Shoulder would be a large joint, so that's got to be our 10, right? Yeah, and we didn't do any image guidance. So 20610 with probably the 5.9. They probably all need 5.9 and the RT on that one. But just to show you what we're doing on those Sunday 2-hour coding things, but it does show you how these headers with the body parts, okay, so you know you're under a particular body part. I'm missing a page here, but goes with the particular procedure that you're doing. If you're doing a replantation, you have to make sure you're under the right header, which is the right body part. So it is kind of interesting. And then be able to match and know how to look up things in your alphabetical index under particular procedures. Like if you're doing an excision of ovaries, right? You can go to excision, then look through all the body parts, find your ovaries. What happens if they're malignant? They actually don't have anything in the alphabetical index for that to show you to the correct codes. They do have the splenoovariectomy, which will get you to the 58720 area, but if you're malignant, you need to be at the 589 area. And maybe I should go to tumor and find an excision of ovaries with it, and then I could get to a malignant ovary. But it's kind of neat because you can make notes and add in stuff that you didn't think that you might need. But it does teach you how to use your alphabetical index in the back of the book, and then how that correlates with body parts and headers and chapters inside your CPT book. So it is interesting, and we are learning some stuff, but it is a lot to learn on top of CPC. Would highly recommend getting done with your CPC first before you worry about tackling Practicode. But we are going over the cases, not every single one individually. I do have them done, and I can show you what the rationales are for a bunch of them quickly so that you can get that down. But we will go over individual cases like this so that you can build a correct answer sheet for whatever you're doing. And then learning how to index and stuff is super helpful. And then knowing what to look for under each can be helpful. So I'm creating more material for the Practicode people, and hopefully it'll be helpful. and those will happen on Sundays. We do 2 hours on Zoom so that you guys can talk and interact with me, and I'm not having to just rely on reading chat. We can have an open mic, and then everybody can participate, and the replay will be good for 30 days, and you guys, even if you can't participate the whole time, you will get the replay thing if you guys want to join in on Sundays. I think we're going to have some classes for on Fridays again, the ones that do not pass their CPC exam, and if you need to do another class with me, but I'm booked on tutoring individual, then you guys can come in on the Fridays classes and do a group class on practice exam questions that are more challenging than what we do on the free live lessons. And those will happen on Fridays, probably around noon-ish time, my time, 2 o'clock in Florida time, somewhere around there, depending on when things are happening. But hopefully that will help for the rest of the month, get people in. We will do a workshop in December. It'll be completely free for everybody. Everybody can just show up on that Sunday. I'm not sure if I'm doing it on the 8th or the 22nd yet of December, but I'll let you guys know soon. But let's get started on some practice questions, just regular ones for CPC, stuff that I know will be on the exam. Be sure to know where this separate procedure thing is located. It's in your CPT book on the first page of the integumentary area. They used to love this question. And if you come to the integumentary surgery guidelines, that very front page, there is a section about separate procedures, and they love the second paragraph where it starts with the word however. That is what they want to know. Do you know a however situation? And that's where this question comes into play. How's everybody doing on TikTok? Hey Crystal, sorry if I missed y'all's messages. Y'all repost them if I missed it. Everything's available on my website at medicalcodingbyjen.com. You're taking your exam, David, on Sunday. Yay. Good to see you guys. So that paragraph says, however, when a procedure or service that is designated as a separate procedure is carried out independently and considered to be unrelated. Those two words are the words that you look for every time you see the word separate procedure. You don't even have to read any of the exam question. If you ever see the word separate procedure, automatically should pop up in your head, unrelated and independent. Those are the two words that should be on a flashcard somewhere I should make, that are the instant, this is what I think of. Go look for an answer that says unrelated and independent. Those go hand in hand. Separate procedure, look for the answer that says independent and unrelated. And then you don't have to read anything else in this question. This is just a copy of the book, and then what page numbers that answer is on, depending on which book you have. Cardiovascular, maybe? Let's go to our 36475. Make sure there's not any do nots, do's, anything listed underneath that code. I know it's the same code listed there. But you want to check your do nots. Do not use this code more than once. That means we're not going to times 2 it. Don't use it with any of these integumentary codes. Don't use it with some of these cardiovascular codes or some of these radiology codes. So there's a whole bunch of do nots listed underneath there. If you guys want to join in on Sunday's Practicode Nightmare, you can book that on my website under tutoring. Arthroplasty is a much simpler term, it is. You guys on YouTube, is it still streaming over there? Let's see. Because I don't see chat moving along. Let me see. And, oh good, it says it's excellent. Okay. I got 12 likes, 17 people on. Pop out chat. Okay. Just making sure you guys can hear me and see me on YouTube. Hey Twinkle, how's it going? Good to see you. Awesome, perfect. You check TikTok. TikTok, we got 36 of you guys on. And we've got A as a possible answer. Hey V. Just had a similar question like this on Practicode. Yep. Practicode is so much fun. Hey Bianca. If you don't know where to start in medical coding, start with my pinned TikToks in the very, very top of the TikTok. Click on my little blue cross at the top, and I've got 3 pinned TikToks on where to start. Thanks, Miss Wendy. I appreciate you hanging out with me and having fun. Hey, Michelle. Good to see you. I signed up for Pocket Prep. Awesome. Pocket Prep is great. Love it. So if you guys are here on, let me get you to my website, medicalcodingbyjen.com. What they're talking about is right here on my website is if you click on this big pink bubble that shows up right there, that will take you to Pocket Prep. Just click on the very first link under medical, and the very top link that pops up right there is AAPC CPC. This will get you access to 750 practice exam questions for Pocket Prep, and it does cover all 18 areas of the exam, including cases. They have 75 case questions. Access to Pocket Prep is only like $15 a month. I buy it annually. I just spend the $95 and buy it annually. That way I get it for $8 a month. I've been on Pocket Prep since 2019. But if you do purchase 3 months at a time for $40 up front, then you get the pass guarantee. So that's really nice. Their questions are great. You get an app you can carry with you on your phone. You can do questions of the day. You can build an exam, like if you only want to do guideline questions, or if you only want to do E&M questions, you could build your own exam and do them. You can do them untimed, not timed. You can try it completely free. They're not going to spam you with a ton of crap bugging you all the time. You just prepay for whatever time you want on the app, and that's all. You can buy just 1 month for $16 if you want. But you do get access to all 750 practice exam questions, including the rationales, and they tell you the page numbers where the answers are, which is great. That's even better than my own site. So if I go here to review, I can look at any question I want, and this is the actual question and the rationale with the page numbers all in one page, which is great. I can move on to the next question, move on to the next question. If I just wanted to review all 750 practice exam questions, but this is just, you know, the review part. You can go back, you can do a study, you know, and then build your question of the day. You can build your own exam. Start a new quiz, do the unchecked part, get your drop down menu and say, well, I only want to do E&M questions, and then I only want to do all 40 of them, and then build your own quiz and then hit start, and then it'll build your own exams. My server brings in a lot of garbage, so that's not Pocket Prep, that's me. But anyway, this is your timed exam. You can scoochie past and do any of the E&M questions you want, and then it'll instantly tell you what the answers are when you pick one of them and show you the rationale. It's really cool, and you get the page numbers where the answers are. Shows you how to use your books, which is super handy for the exam. Love it. And they're always updating their questions. They're fixing to come up with a new way of they're going to start rating the questions to their difficulty, and having some like, I only want to do the beginners, and then I want to do medium, and then I want to do super tough. So they're going to come up with some new ways of doing Pocket Prep, which I think is pretty cool. You can do just your missed questions. You can do time quizzes. You can battle out with everybody else at the question of the day. And it'll encourage you too, like, don't forget to hydrate. And you can look at your stats and see how well you're doing too, and if you're working on it every day. So super cool. You can calculate your performance and see how well, based off what you're doing right now, would you be able to pass the exam. They're coming up with some new little features too, so I think that's kind of cool. But anyway, love Pocket Prep. Again, you can reach that link right there on my website at medicalcodingbyjen.com. You don't even have to log on, just click it right there. I do have a set of practice exam questions of my own. You can come to the practice area. It's totally free, and you can do these practice exam questions. Just click on whatever answer you think it is, and the rationale will come straight up. There's some PDFs that you can download instantly from here. There's some trivia quizzes. You can participate in all these E&M flashcards. There's 3 sets right here. Do those. You can download these PowerPoint slides right here. Super interactive. You get to click on the heart and it'll fill in the blank on the positions and parts and stuff. And then this that's flashing is a PDF that you could instantly download with acronyms in it that is totally free. So there's a lot of little free stuff here too on my website. Don't forget to go to the resources tab. If you want to know how to book prep your book, just click on the book prep page. It'll have 8 pictures on it, and then you can click on the 8 pictures. It'll show you how to prep your book, including your anatomy pictures and your ICD-10 book for the exam. There's also free resources like free videos on how to book prep your books. The digestive system videos are right there. You can watch those. Super helpful. All of the social media links are right there. If you want to join our free Discord group, it's right there. If you want to know how do I make my Lazy Susan, what book holder do I use to build that, or whatever, I got it all in my Amazon list right there. You can click and join, and then scoochie on down here to how I built my Lazy Susan. You just get 2 of these bamboo book stands. Make sure they're the extra large ones right there, and then get this 18-inch Lazy Susan with that $3 adhesive strip Velcro, and slap those 3 things together and you'll have a really nice Lazy Susan that will hold your CPT book and your ICD-10 book and twirl around. That way you're not destroying your books. It's really handy. The camera that I used for my remote exams, peppermints, the chair that I used, the desk that I used. I used the camping desk for 2 years. Twinkle was with me when I got my electronic lift desk, but I used the camping one where I could stand and sit, and I just manually adjusted it whenever I wanted to sit and stand. My quiet keyboard and my quiet mouse that don't click out loud. You can't hear me typing, so I love those. Everything that I use is right here. So super handy dandy, all in one list. It's right there on the website. I can't get into my Facebook group or my Facebook page. I've been banned yet again. It happened in August for impersonating somebody, but how can I impersonate when I own the company? I am Medical Coding by Jen LLC. I'm the owner. I own it. So I don't know. They keep banning me out of the group every once in a while, but we do have a Facebook group, and of course the YouTube channel. There are a list of additional educators. Super handy dandy. Don't forget about, under the resources tab, go into the FAQs page. Totally free for you guys. Go here to the free list of resources. And if you have any downtime during the holidays, be sure to click on the CMS free certification classes right here. Click on that link. It'll take you to the government website where they're doing Medicare Learning Network. And this is where my employer sends me to do abuse and fraud training every year, right here. And I have to get this done every year. You will get a certificate at the end of these. It's nothing that you have to sign up for, nothing you have to pay for, but they even have an ICD-10 free class. They have fraud and abuse, which my employer makes me do, which if you come and do those and go on and put them on your resume that you did them, then your employer knows that you've already been certified and they won't have to do that. They have a class on PCS coding. They have a class on Medicare. The one on the CMS forms for electronic claims is really cool. But all of these are free. You can do them unlimited amount of times. No one's going to track you and say that, you know, Sally Sue took this class 15 times and she failed it. They're all super short, less than an hour long courses, and stuff that you can take. You will get a certificate, and then you can put that on your resume. grievances and appeals are two areas that always have job openings. I would take both of those if I was brand new and new. Anyway, that link is available on my website. There's a ton of free resources, including the shared gallery, which is totally free, of all my favorite pictures that are super handy dandy and helpful. Be sure and check out my website. And the free blog. This is how you get a job. I post job openings here. I post a ton of practice exam questions here, like MA surgeries right here, outpatient surgery questions here, job resources. What other keywords can I look up for CPC jobs besides just saying CPC? This Elements of MDM is a 9-chapter book that I wrote on just doing problem list, data, and risk adjustment coding without time or MDM. How do you do it? With practice exam questions is all right there. So tons of free stuff here for you guys. Don't forget to check that stuff out. All right, let me get to, I forgot to do the little thing for TikTok, the little puzzle piece, but hopefully they came over to YouTube. Let me get back to the practice exam questions. Right here. We were doing this cardiovascular. If we're doing the sap vein and we're stabbing the heck out of it, there was a practicode question about the stabbing. It was crazy. We had 14 incisions on the practicode one. Anybody get an answer for this one? We got D. Let's see our differences between C and D. If we're doing two procedures and the second code is not an add-on code, like what is 77999? What is that? 377? What is our 377? $99. That's an unlisted procedure. It is not an add-on code. 7765 is also not an add-on code. 6467. If you look at any of these, are any of them add-on codes? If it's an add-on code, you don't have to have a modifier, right? But if you do something that is its own mama code, and you do both of those procedures, then do you need a modifier? That little tidbit can help you look at these available answers, and you can see there's only one possible answer that is correct. Because you need your modifier to go on your second code to notify the health plan that, yeah, I did a separate identifiable visit that day. It's a distinct, different procedure. Even that 51 modifier that says multiple procedures, technically you don't put that on the first code, right? You would put it on the second one to notify them that, yeah, this is a multiple procedure. We did multiple, right? But the only answer that uniformly is correct by just looking for patterns in the available answers and what would be a correct answer if you did do two codes. Now, if the second code is an add-on code, you don't need the modifier, but none of these seem to be add-on codes. Yep, that is C, the correct answer. Also, if you look up these codes, that's what they look like in the CPT book, unhighlighted and everything. But if you do look in the 2024 book on page XIX, you will see that they do have an example of a radio frequency ablation where they did the 10 stabs or less, and it tells you to use the 37799 with the modifier 59. One version of the exam does ask you about National Correct Coding Initiative, which is an indicator. The CCM is a 0, a 1, a 2, or a 9, I think. This is in the front part of the study guide. They do go over it for just a second in the study guide. We have two answers that start off with the same answer, right? What's our differences between those answers? One that is not allowed or one that is allowed. When you're talking about NCCI, the modifier is allowed or not allowed. Even in the wordy questions, I still look for similarities. I would exclude and probably wouldn't read C or D because they start off with different words. Usually, if they start off with the same word, then there's just one little thing that's different between the two. One's not allowed, one is allowed. That's the difference that they're wanting to know if you know that particular difference. And if it is 0, 0 indicates is allowed or not allowed. It is in your HipPix book too, if you ever wanted to look up your answer, if you happen to have the AAPC version of the HipPix. It's around page 617 to 622. It's also mentioned once on page 607. A is the answer. 0 indicates not allowed. You're looking for the number 1. If you're looking for the modifier that is allowed to be passed through. If it's given the number 1, 1 is allowed. 9 is not. 0 is not. Yeah. Yeah, I did write them out. It's not 2. It's just 0, 1, and 9. They are mentioned in the study guide. Is it the chapter of Business of Medicine or... ABNs. No, it must be in the CPT section. Yeah. There it is. So if you have the AAPC version of the CPT book, they put it in where the Introduction to CPT, Surgical Guidelines, HIPICS, Category 2s, and Modifier chapter. And they have an example in the study guide. So it's right there, what they're talking about. Any version of the AAPC study guide is always kind of handy to have around. All right. As soon as there are no physicians' hospitals, what are we looking for? Oh, the complete documentation. We did this one the other day. 24 hours? Yeah, we did that one. All right, move on. Integumentary. We got 2 of them that are in the 151 area. So I probably just run to that area. Are we doing split thickness? Or are we doing epidermal? How would you know? We've got epidermis and dermis. That is 2 different layers of skin. So without saying it, indeed, we are split thickness, right? There's what the codes look like in the CPT book. And then what our answer is. When coding, what book do you start with? The ICD-10 or the CPT book? It depends. Are you coding for diagnosing? Or are you coding for procedures that you're doing onto patients? Just depends. The main thing is, what I like to teach is how to pass your medical coding certification exam. You don't need a course, and there's no prerequisites required. All you need to do is pass the certification exam. then you can get in the job and start working. It's going to be different no matter what. Even if you take a course, even if you pass your exam, coding in real life is still going to be different than what you learn in a course or whatever. So might as well just get the certification done. Get yourself into a position. Usually auditing for HEDIS measures, something like that from October to February is always a great time to get a position and get your feet in the door. So from the certification exam, it's only one test you need to pass. It's 100 questions. It's multiple choice and open book, so you get to write whatever you want in your manuals. We like to practice for the certification exam. Would I be in the 50,000 section with this question, or would I be in the 10,000 section for this question? There's no ICD-10s in this one. It's just CPTs, so it's just procedures. Would fine needle biopsies be in the integumentary area, or are we going to be in the back near the prostate codes? And then, would I add radiology to the end of any answer? 3 of our answers all have radiology in them. Would that be something that we would need to code in addition to procedures that we performed, or would it be included? I would shy away from any of the radiology. And if it was just me looking at this question, I probably wouldn't look up any codes. I don't know. I would probably pick the one without radiology, which is B, and move on to my next question. If you're taking the exam anytime this week, let's see. Be sure you know where in the book you can find a list of your coronary arteries and a list of where your coronary branches are at. Be sure you know the differences between nephrons and neurons, NOS versus NES, ureter versus a urethra. You know how to code burns and adverse reactions and food allergies, overdoses, tissue transfers with punch biopsies, what a Warthan's tumor is, what a VBAC is, how to code a penile prosthesis if they have an implant, intersex assignment surgeries, know how to use modifiers 76, 77, 73, and 74. Phalanges, the differences between autograft and allograft, and if you are turning blue, what is the medical term for that? Here's what the codes look like in the CPT book. I love this chart right here in your book. It is super handy dandy. Just be sure that you know that this word just means shaved. They're not going to use that word in the exam question. They'll just say shaved. So if you had 2 shave biopsies, here's the answer. Tells you what the answer is. If you had 3 punch biopsies, here's the answer. Super handy dandy chart to know where it's at in your integumentary section. I had a question on my exam that had an incisional biopsy, a shave biopsy, and a punch biopsy, and I was struggling figuring out which one would be coded first, and the answer was right here on this chart. That was back in 2019, but the question may pop up on yours. Handy little chart to know where that is. And this is one of the questions from Pocket Prep. This great little question from Pocket Prep. ICD-10 question. In that book, it's in integumentary, so it's in the very front of your integumentary book pages. It's right, if you're in the 2024 book, it's on page 86. It's down at the bottom. ICD-10. Would we be an S83-5 since we have it down twice? D has an S83-8 and B has an S83.4. I'm more inclined to think it's an A or a C. And then you just need to know, would we have a W or 2 Y codes? 3 Y codes? Does that look normal? Or would we have a W, a Y, and a Y? What would be more likely the answer? You had a question that had a shave and a punch biopsy? Awesome. If you had one shaved, you're going to have the O2, and then your punch biopsy is going to be the O4. The punch is would be the one that goes first because it goes through, you know, some skin layers and levels. It's the one that's at more risk for having an infection, right? Because you punch through the skin. So that one would go first, and then your shave would be second. You can still use that little chart to help you figure out what the answer is. Shave would be, the punch would be the O4, and then the O2 would go second. Yep, A would be our answer. Don't forget, I love to do this in my alphabetical index. You know, we have 5 different things we're supposed to be able to code when a person has an injury, right? The cause, the intent, the place, the activity, and the status. What were they doing? And they all need to be coded in a particular order. The first order is cause. The place that it happens needs to be coded as the 3rd code, and having to memorize all that is super hard. I'll go through my alphabetical index and I put this on the header, and then I highlight with those highlight colors just lines down things that would be intent. The places I highlight as yellow, right? Status is like, are you a volunteer? Were you employed working at the time? That kind of stuff. Were you overseas for the military? Whatever. So that's kind of helpful. I also like to think about my second codes as, you know, different color codes. You know that Y is in every single answer, but should it be second or should it be the last code? The yellow code was associated with the baseball. That's the status. The patient was playing some baseball, right? And then they were at home is your place. They were stumbling around. Very cool. There's our rationale that goes with that question. E&M question. Are we a level 2, a level 3, a level 4, or a level 5 E&M visit? We know they're all for new patient. The 0 in the 4th digit indicates that all these answers mean that the patient is new, which is cool. It's all under one thing, so don't have to worry about that. Do have 3 pages with this one. We have a patient that has a chronic issue. If you don't have MDM or time, then you need to be able to pick out what their overall MDM was. What was their problem list? They came in for a chronic hernia. What test did we order? What records did we review? Did our physician consult with another physician? Did they look over a bunch of records? What was decided? We're just going to observe and repair it. So we're leaning towards a laparoscopic repair. So is that a decision for surgery? What risk does that put the physician into and the patient? What answer do you guys think it is? Yes, there's lots of tests for beginner coders, absolutely. That if you are on my website at medicalcodingbyjen.com, if you do come to the practice area, totally free. You've got a lot of practice questions here that you can do for practice. Also, you can go to Pocket Prep, you know, for practicing exam questions for AAPC. Just click on medical, click on AAPC right there, and you get 750 practice exam questions in all areas of a medical coding exam for around 15 bucks. Super cool. They do have a pass guarantee, love them, but also you can also go to the certification place that you are going to take your certification exam at, right? You can go to AAPC. You can go to their website. You do not have to buy a course. Just click on the certification that you want to do and you want to practice in. Even if you don't want to do CPC, if you want to be a biller or if you want to be an auditor or a risk adjuster, just click on any of them and then click on the drop-down menu for prepare for exam. Then just click on the practice exam questions right there. CRC, practice exam questions. It'll bring you to this page where in the center you can change it. Let's say I want to go back to CPC and I want to do those for medical coding. You can just purchase the bundles for just the practice exam questions right there in the middle. Don't buy the course. Don't check that. And then just put those in your shopping cart and buy them. You can do just risk adjustment right there. You can do the speciality. So let's say you've already done all the ones for CPC and you want more. You can click on something like CEMC. That's just E&M practice questions. You can purchase those for $40 right there and practice those. When you do purchase the practice exam questions, it is cool because you do practice those practice exam questions in the testing environment, the actual environment, whether you're going to do your certification exam at home or if you're going to take it at a remote testing center. Doesn't matter. It's still going to toss you into this particular website and you're still going to take your certification exam right here from this page. You do have the option to take your certification exam remotely from home, or you can take it remotely at a testing center using somebody else's computer and internet. Either way, it's still going to look exactly like this, and this is exactly the same testing environment that the exam will be in, is this page right here on this website, Scorpion. So that's kind of cool. Getting in here and practicing, learning how to find all the questions, what they look like, how to sort through them and find the ones that you want to do first. Doing those first, picking out the correct answer. Look, we know the answer to this one. Is this a cancer or is this a benign thing? We have cancer, basal cell, right? So are we a 1602 or are we a 1606? Just look up your differences between those two things and then do it right here. We have a 4 centimeter plus margins times 2. So what's our differences between our 116, our 11606 is by over 4 centimeters. So we know we're over 4. There's our answer. And we could submit. And even if you don't want to do the entire exam, as long as you've answered one question, you can go on and submit the entire exam for this practice exam question. You don't have to save it and do, all 50 questions or however many is on this practice exam question. You can go on and view your results and see how you did, get your correct answer, and then show the rationale on that question. And you want to be able to practice inside the correct testing environment. So I highly recommend you do go to AAPC's website and you do purchase some of their practice exam questions and then learn how to navigate in those practice exam questions and practice all you want. You do get access to those practice exam questions for one entire year, 365 days from the date of purchase, that you can redo them over and over and over again multiple times. So, super handy dandy. Or you can come hang out with me here free on live on YouTube and on TikTok, and you can do practice exam questions with me for free until you get to learning some stuff. But this one is definitely going to be moderate, right? For our decision for surgery. If you look at page 10 in your CPT book, we will look under our problem list. Anything that says it's a chronic can only be low, moderate, or high. Our data, we probably had minimal. And then our decision for surgery tosses us into the moderate or high realm. And because we've got 2 matching, our moderate for our chronic condition and our decision for surgery is also moderate. That's why we came up with the 204. All right, for this cardiac test, we're in the medicine section in the back of the book. We've got 2 of them that are 16 and 2 answers that are the 15 code. We just need to go to those 2 different CPT codes and see which one we are by looking at the differences between those 2 codes. Lots of people sell the courses. I don't recommend them. You can do self-study. But, you know, lots of people sell courses. Just do not purchase a course from NHA is about the only thing that I absolutely, please do not do that. Only purchase your course from aapc or from ahima if you're going to purchase a course. Just get one from those 2 people. I do have a list, of course, of additional educators on my website. So if you are here at medicalcodingbyjen.com, if you hover over the social media tab and click on the additional educators, I teach for free, so all my courses are for free. But there are people here that probably will sell you a course. The one that I've attended some of their courses and I kind of like because of the price of them is Integrity Coding. She hires a bunch of medical teachers and they'll do like $50 courses. You know, it's more like a boot camp thing, not an entire course, but you know, I like her because her courses are very inexpensive. So instead of spending $3,000 to $15,000, you can get a $50 course. But like I said, underneath the resources tab, underneath the FAQs, go here and there is a free course from CMS right here on the government website. Look, ICD-10, completely free course. It will show you how to identify ICD-10 codes, the structures, the format, recognize features. It's totally free. And you get a certificate. And this is actually from the government. And these certificates are recognized on your resume. And you can get continuing education credit also from aapc or ahima for attending these courses. So there's a lot of courses here that are free. So, and you can fail these like multiple times and then keep retaking them and no one's going to keep track. There's no tracking. You can do this course over and over again and it's totally free. My employer sends me here once a year for fraud and abuse training that's required. So be sure and take that. Anyway, don't technically recommend any courses and I teach for free, so come hang out with me. All right, back here. Are we a 15 or are we a 16? What did we do? We're doing supervisory of the test. Usually it's the tech first doing the test and then physician stuff is the next set of codes. So I'm going to like the 16 off the top of my head. And then it's just a difference. Would I be coding 3 codes versus 2 codes? No, it's 2 codes, right? They're always trying to push you to code more than you should. And if it's just a difference between that, pick D and move on to your next question is what I would do. 16 for the test and 18 for the physician to interpret and study. official report probably. Indeed, D. Katrina, thanks for the follow. Here's what the codes look like in the book. Ooh, Lab and Path. 822 codes, and they're all in a row. So we just have to run to those, see what our differences are. Grandma had one slice. I only had the one that you gave me. Grandma came in and had a half a slice yesterday. Probably Travis. Or James. Probably not. He's such a fat owner. He doesn't want to eat fat products. Probably him. Who knows? I only had the one that you gave me. That was it. The cheesecake disappeared. I was defending my honor. I didn't eat the cheesecake. You know GUAC will be on your certification exam. Knowing the differences, how they collected the specimens. Are they on cards? Were they digital exams? Did they collect stool, or is this an amino acid test or whatever? They have all kinds of different versions of these. Ooh, let's see, 822, 70, blood occult, 71, other sources, so they're not using stool, right? 72 is other than colorectal neoplasm screening. What does it have in the parentheses? Which is more likely to be on the exam question. That's why I have you guys go through the entire book. And if a CPT code has those little C brackets, right? Those are the words that usually appear on the exam question, right? That's why I make y'all highlight them. The only CPT code that actually has a bracket that has that word in it is 70 and 72. The difference is 70 is using 3 cards. 72 can be using 1, 2, or 3 cards. This one only used 2 specimens today. $70 means the patient collects the stool and does it themselves at home. 72 is where the physician collects a sample and does it. 74 is an immunoassay test. which is not noted. This is what the codes look like in the book.
Is there another one?
Yeah, there's 2 of them. I put them in the cabinet today. Look up high, way high, in the cabinet. I gotta go find some beef broth. That's why this one is 72, not D, not D. All right, y'all work on this one while I go find that broth. Find it. All right. Psychotherapy. This will be on the exam, some way, fashion, form. Somebody's going to have some sort of counseling done. Knowing your differences between the codes. Knowing the differences between the therapies and whether family's involved, not involved, whether it's a team or a group. Situation or individual therapy. We've got 2 in 3-9 and 2 with 3-2, knowing which set we are. And then figuring up, are we times 2ing the second number or not? We'll be back on Friday for 2 more hours. Oh yeah, lots of jobs. If you are in our Discord study group, which is super handy dandy, I have our main chat room and then a room for where to start. And then if you keep going down, each certification has their own room. So like if you want to do just practice cases or CPC cases or CCS cases, COC, everybody has their own practice room. But also we've got job assessment rooms. So if a job gives you a job test or an exam, we post them in here. Job resources is where I've been posting all the job openings like LabCorp, Cone Health, Laurel Health, Legit Scripts was hiring last week. Some of these don't require any phone calls. The LabCorp one was just texting back people that text in questions and then you text them back answers, so it's great. There is a huge list that I've been working on: M Health, Corona Health, Wellstar, GBBs, McKesson, Weller. I post them all in here in our Discord study group. So if you have not joined the free Discord study group, you are missing out on tons of resources. There's just so much posted in all of these rooms. There's a search bar feature. You can just search whatever subject you're looking for and it'll pop up and bring up any of them. But there is 3 years worth of information in here. You can even post about your fur babies if you want to. So we've got lots of information in here, including who all we've helped. If you need resources after you pass to get continuing education, even practicode help, all that stuff, it's all in here. So super cool. Be sure and join the Discord study group. That link is in bio. It's also on the website, medicalcodingbyjen.com. Woo! Duck class. That would be great. Go-kart wants a duck class at noon. I gotta remember to put that up on the website. And then we'll also be back at 3 o'clock for 2-hour live lesson of more practice exam questions for everybody. And then Sunday we're doing practicode. So we got lots of little classes. Absolutely. This one is A. We did the ×2 on this one. And I think this is actually on the exam. The crisis scenario, something about somebody losing their sister or something. And so I believe these codes or this situation of some sort might be on the exam. Super helpful. This anatomy question has also been there before. Which one of these is hives? Rash, eruption, dermatitis, which one? You're starting MBC next week. Awesome. Yeah, there's a salary thing on AAPC. You can go there and figure out what your salary would be in your area. They do a lot of yearly work on capturing information nationally on what jobs are paying, but most of the time, most people just stack jobs. So if you get a job that's paying $40K a year, answering text messages to patients at LabCorp, right? You get comfortable in that job in about 90 days, and you get real comfortable within 6 months, and you know your job, and you've got pre-written out forms and answers and replies stacked for tons of patients' questions. You know, they keep asking the same questions over and over again. You've already got a whole sheet of copy and paste answer replies back to them, and you're super comfortable in your job. Then go get a second job doing the same thing with a different company. And then you turn your $40,000 a year job into an $80,000 a year job, and you're doing the same thing for both companies. That's what a lot of people do, stack jobs, until they get into a managerial experience job. That's the one job is paying, 6 figures. You can take 2 jobs and make it 6 figures. There's tons of jobs out there. Don't worry about that. You just got to get your foot in the door. Which one are these? I've seen someone stack 4 jobs too. Yeah, that's crazy. I've done 3 before, which is crazy. But I was an auditor and data analyst for one company, and then I took on 2 home health agencies who failed their audits, and then I went through their OASIS and wrote them some policies and procedures. I already had it pre-done, and then just came into the offices on Fridays, 1 day a week, trained their staff, redid their manuals to say they've all been trained on the proper procedures and stuff like that, and then attended their next OASIS audit and made sure they passed. So that was 3 jobs in 1 year because I took on 2 home health agencies. But it just threw me up into such a high tax bracket that 75% of what I made with the other 2 jobs salary only got to take home like 25% more. So you got to be careful. I didn't have enough deductions, or maybe I didn't know how to claim a lot more than what I could have. I should have claimed, mileage more, or uniforms, or printer paper. I don't know what I could have put on there to claim more, but taxes are crazy. I hate that. You pay taxes before you get your paycheck, right? And then you pay taxes on everything you purchase with you've already paid tax on money. And then everything you purchase has more tax on top of it. So, I don't know. It's just, and then you got to pay annual taxes on top of it. And then everything you purchase, you got to pay taxes on it to keep, like your home and your car. Every year, if I want to continue driving my car, I have to pay annual tags and license. And then my home, even though I paid it and it's paid off, I have to pay annual taxes just to keep owning it. It's a lot. Taxes take out a lot. But we still don't have free education or free health insurance with all those taxes we pay. I don't understand none of that either. All right. Another term for hives is not rash. Yeah, it's our fancy eureka, Eurycarta, whatever that word is. It's too much fun. SH. Be sure you know where to find those modifiers in your HIPICS book. It's actually just the letter S modifier and just the letter H modifier. Those are near the A codes in the front of your HIPICS book. So where you go to find your ambulance driving codes, there's going to be a single little chart right before you start coding those HIPICS codes that will tell you that S means we picked up a patient at an accident scene, right? And we took them to H, which is a hospital. Be sure you know where those modifiers are, along with these ambulance codes. That is super handy dandy. Is a degree worth it? To get into medical coding and to start, no one's going to care if you have a degree or not. If you want to move up in administration and eventually be a supervisor of a bunch of medical coders, or to run a team of medical coders, or to run a hospital's team of coders, then yes, a degree will make a difference. But to get in the biz and start working, no one's going to care one bit. But eventually, if you want to be a bigwig that only works 1 day a week, comes into the hospital and scares everybody in their high heels, and just attends a bunch of medical conferences and is always out of town or always on vacation, if you want to run and be responsible for everything that goes on in a department, eventually, yeah, a degree will matter. What I recommend is just going forward without a course, just pass your CPC exam, get started with the company, and then have that company reimburse you for education. So go to your local community college, take a class, get your FAFSA, take the money that they give you for FAFSA while you're working as a medical coder and stick that in an IRA and leave it every year for the next 40 years. Don't ever touch it. Let it build. But have your employer also pay you back for the money spent out of your FAFSA to pay for that college hour. So, 3 credits for an English class or, whatever, to eventually get your bachelor's degree, $80 a credit hour, whatever. It's covered for FAFSA. You could get it paid for, but then you could get it reimbursed through your employer. Every time you pass a particular subject, they'll reimburse you usually if it's going towards a degree. Anyway, you could eventually get your associate's degree and then get your bachelor's, yes, and master's, whatever you wanted to do. But I would make an employer pay it, and then everything I get back from FAFSA, I would just squirrel. What do you guys think is the answer for this one? Thanks, Jess, for the follow. Good to see you. I got A's and C's. A is correct. Here's what the codes look like in the CPT book. I am streaming this live on YouTube with a better view if you guys want to go to the YouTube channel. A is the answer for that one. Speaking of YouTube, what do you guys think is the answer for that one? Let's give out some YouTube subscriptions. To those that are still hanging out. I hear my Star Wars going on in the background. I did go on and post the condensed study guide. So it is up if you guys are looking for it. Mari, Hunter, Salty, Maid, Brittany all have access now to my YouTube channel and all the exclusive content. So, like those that are here, if you're in my website, medicalcodingbyjen.com, if you go to the social media tab, there's the YouTube channel. Super handy dandy. All the replays of all of my free live lessons are right there on the live tab if you click that. These are all the repeat lessons. You can go from one lesson to another and listen to those. You can go to the shorts, which are a lot of practice exam questions. You can do one question at a time, or you can do, watch my short little videos on how to do the process of elimination or something. But I got a lot of short videos that are less than a minute, super handy dandy. You can go to the playlist. So if you wanted to just do book prep, right? You can go to the CPT book prep page and click on the view list. Click on that down there. And then you'll get a list of all of the book prep videos that I have. So if you want to just go do respiratory or lab and path or the guidelines, you can go to whichever side of the book you want and watch those videos if you have a YouTube membership. It's only $4.99, so not bad at all. But you guys that just won the membership, you guys get that for free. I also have 2 podcasts where I'm reading out the E&M guidelines and telling you what it means, and then also the E&M guidelines too, along with the ICD-10 guidelines. So super handy dandy. So all that's available here on the YouTube channel. I've already got the stream up for Friday for the free live lesson. That'll be there, so you guys can go on and click on that. And if you need any of the links, they're right there in that drop-down menu on the YouTube channel too. So there are links there for my website, the TikTok, the Discord study group, AAPC's Knowledge Center, the podcast, and the Amazon shopping list if you wanted to make your Lazy Susan or whatever on that website. It's all there for you. Anybody got an answer for this anatomy question? I hope to see you guys back on Friday. Are we right, left? We're right. Perfect. When is it documented that a patient has both tobacco, is using tobacco, and is dependent of tobacco? When they document both in the chart, that they use tobacco and they're dependent on it. How do you code it? I'm addicted to this Red Ryder punch. It is good. We have this guideline little table that I love that's only available in the AAPC version of the ICD-10 book. So if you don't have that version of the ICD-10 book, you can screenshot this and put this in your book. I think it's handy to have because if your patient uses, abuses, and is dependent on a particular drug or anything, then you can only code for one of them. And remembering which one you code is a little difficult. So I like this little chart that AAPC came up with. Love it. If they have all three, you know you only code dependence. If they abuse it and use it, you know you only code abuse. So handy dandy little chart. But A is the answer. Gabby, thanks for sharing the live. Thank you for the 5,000 taps, guys. Thank you for all the shares. Thank you for all the love on all the videos. Every time y'all comment, interact with any of the videos, it helps get out the word, helps the view count. I have 1,229 videos on YouTube. Wow. That's crazy to look at those numbers. And we've got 20 watching now. Decompression of a nerve. We got 2 segments of the lumbar spine, and we have a trans approach. Would we be a 56 or would we be a 30? And then would we be 1 code versus 2? Sorry guys, I got distracted. What do you guys think? Yeah, isn't that crazy, Patricia and Go-Kart? It is our biggest code and 2 codes versus 1. Isn't that crazy? Totally against anything that's in the process of elimination or looking for your similarities. It is actually our highest code and it's coding both of them. But anything with decompressions and nerve roots usually is 2 codes. Knowing whether you need modifiers and stuff is super helpful too. This is what the code sets look like in the book. I think that code 69990 is on the exam, so knowing when to code those and when not to is super handy dandy for exam day. Six, 8, 9, 40, and 43 are like the closest to. I'd run to those 2 first, see what our differences are, and see if that's what we did today. And 43. This word makes a difference between those 2 codes. What's another word for that? Y'all are going down to the 50s. She's doing total abdominal hysterectomy, pelvic limited. Where did they remove her cervix? We might see the word assessment of the abdomen, but that doesn't mean that they removed and 50 is under a resection. What is a resection? All they did today was this. What is a 40? The 40 is an ECTOMY. What does a ECTOMY mean? Removal of ovaries, which is in the 40, but 43 says this word in it with multiple biopsies. 50 is hysterectomy, we did not do. 8720 8720. 8720 is just removal of the fallopian tubes, which is not what we did either. A is our answer with this one. A. It cannot be C because that is just removal of fallopian tubes. We did not do that. 40 and 43 are the same procedure. The only difference is, technically, one is for cancer issues, right? One of them has malignancy. It is for a malignancy. That's why A is the correct answer, because it is under malignancy. It's the only code that has malignancy in it. And she already has it. She doesn't need to be diagnosed as that. This patient previously had hysterectomy. That's not what we did today. It's definitely not 50. That is another hysterectomy. 43 is the only one with the word malignancy in it. The documentation says posterior vaginal and outer cervical. OS was cleaned. What does that stand for? Does that make sense, Miss Sherry? Nine 90840. 90840. Psychotherapy for crisis for an hour and 30 minutes total. Psychotherapy for crisis is an urgent assessment for a patient in a crisis state. We're going to do a mental status exam and disposition. The psychotherapy includes mobilization of resources. That means getting to a patient like up on a wall, fixing to jump. We're restoring the safety, getting the patient down off the wall. We're also going to implement interventions to prevent further trauma that day for being up on the wall, right? The problem has to be life-threatening that day and a complex situation and need and require high and immediate treatment for a patient in distress that particular day. Anytime you're going to do 809, 40, and 39. There you go. That outer and internal OS and external OS, I had to draw into my CPT book, and it might be a good idea if you guys did too. It's handy dandy. All right, guys, I'm going to end it here. We've been on for about 2.5 hours. I'm going to go see what happened to the kitchen. I think it just got destroyed again. So I'm going to go get ready for tomorrow. I hope this was super helpful for you guys. I love you guys. I hope y'all have a great day tomorrow. And I will see you on Friday. Look out on my website for our duck class and for Sunday's class for Practicode. And I can't wait to see you on Friday. Hope this was helpful. Love you, V. See you later. Y'all have a happy day tomorrow. I hope you don't have to work. Thanks so much, Twinkle and Go-Kart. I appreciate you guys. Hey, Patricia. Happy, happy, happy Gobble Day. I hope y'all get to spend some time with your family. I saw somebody with a TikTok who daughter said she wasn't going to come home for Thanksgiving or something from college. And the little girl was in the trunk or something, and her mom was like, I'm not worried at all. I know she's going to do the right thing. Did y'all see that one? It was so funny. I loved it. I thought that was great. Additional time. Mm, 100 minutes. That is 60. What's 30 plus 30? So we'd have 160 minutes technically, really. But what if we've got, okay, 60 minutes plus 40. Maybe they meant, maybe it's a typo. Because if you did 60 minutes, hold on, where's our 98? 908, 908. Is the first one for the first hour? Yeah. And then 30 minutes afterwards. So maybe they meant 120 minutes or something. Because if you do times 2, it's going to be 120. Maybe we got a typo or something. They wanted the times 2. So, but I wonder, like, what if it was something like where you had to do half plus one more, so it would be 16 minutes for the other one. And then we did 30 minutes for the other one. And then we've got 60 minutes for the first hour. What if it was that? So that would be 6. 6, 7, 8. Okay, wait a minute. So if we had 30 minutes and then we had 60 minutes, so that would bring down 6. Yep. And then we don't need that 1. 60 plus 30 plus 16. Simple as that. And then that would be, we can't do minutes in like that. We got to do an hour and 46 minutes. Anything an hour and 46 minutes is going to be technically. What's our rationale say? 30 minutes, the last 75 minutes took longer. What are they saying? That covers 0 to 90 minutes. And then 91 to 100. They need a chart over here to do all that crap, right? 40 does 60 to 90 minutes, and then 90 to 100 minutes is
Chicken thighs, bacon, potato, veggies, mozzarella, sour cream.
oh my gosh. Wow.
And I got a loaf of bread going
Cool.
and a roast.
So probably need to write this chart out beside these numbers. Then 90840, because they've got it written out the way they want it done, is that 61 to 91 minutes, and that's only 1 minute after. Usually, you know, you'd think it would be 60 minutes plus 16 minutes would start your 40 code if you do the half plus 1 area. But according to this rationale, for some reason, they're saying even 1 minute over constitutes being able to bill it. But they're saying 61 to 90 equals that one, and then 91 to 100 minutes equals times 2. I don't know why it's not half plus 1. There may be some verbiage up here in the guidelines that I haven't read yet. Psychotherapy for less than 30 minutes duration on the given date should be reported as a 32. Yeah. And it may be because of the situation. It's high complexity, it's life-threatening. Maybe some of that has something to do with not having to do the half plus 1. But whatever the rationale is here for this one, we need to write out exactly what they want. So for this one, for the 9840, I put 61 through 90 means 40. And then 91 times dash 100 equals times 2. That way we've got it in our notes the way they want it as far as presenting for an answer. But something about this code must mean that we don't have to have the half times 1. Half plus 1. If I was doing it with the half plus 1, it would mean that 76 minutes wouldn't start, and then that would be the 40, right? 76 through would start just adding the 40, but they're apparently not doing the half plus 1. is the only thing that I can see. Times 2 is 91 minutes through 100. So this was 100 when we originally saw the question, I think, right? Can't remember. Yeah, I wrote down what I said. I said, I see it. Well, we're going to write it down the way they want it, right? Because the answer is not the half times the 1. So, all I've got written down here is that first 60 minutes is our 39, right? And then if it's 61 through 80 or 90 minutes, then we're going to add our add-on code, right? This is an add-on code. So it's one of the ones that we get to times. No mods. This is the 2025 book. I don't have notes back here yet. This one won't be coded by itself. It is an add-on code. It's a telemedicine code. We're going to add it to that. It is in each. No modifiers because it's an add-on code. And minutes. Must be something about it because of I mean, if you're pulling somebody up off a wall and they're about to jump, we're not going to half the time and add 1. Every minute counts in this situation because it's a super urgent and we had to dispatch to a person in crisis. And there must be something written somewhere about this. I don't see any, like, yeah, there is CPT changes of 2013, and I wonder if I have that book. 2013. 2006, 2020. 2019, 2015, 2018. I don't have 13. I need to get that year. I don't have that year. I don't have that version of CPT changes, but all we can do is, you know, use their rationale to do our best to try to figure out why the answer is what it is. But I don't see anything written up here in these guidelines that say anything about time exclusion. There might be something in the time area in the E&M section about psychotherapy, though. I wonder if it's got a special guideline. see. So, our time leveling guideline, does it change with psychotherapy? If there was anything written about we don't use it, or if there's something different for a different type of physician, it would be listed here. Full 15 minutes is required before reporting, blah, blah, blah. I don't know. Anyway, sorry guys. It had you wondering. Yeah. Thanks, Tracy. The guideline says up to 74 minutes. Yeah, that's what I was thinking too, 74 minutes. But whoever wrote the rationale for AAPC, or whoever I got this question from, you know, everybody makes mistakes, but they do have it written out like that. I don't know. And this may be one of the areas where they have the rationale written out wrong, and then that's why people are getting this question wrong on the exam. Something I need to further look into. I need to go get that book for the 2013, because that would clear that up. It would tell me more information about that particular code. Because those books are really, really cool if y'all have not seen them. But you have to buy one every single year, and they don't update every code every year. They only do a set amount. So it's crazy, but they give you the full descriptor of a particular CPT code. So sometimes, you know, all the code rationales are a lot bigger than what ends up in the CPT book. You know, they're only doing one line, but the real meat of a code ends up in these books, which is this CPT assistant insider view crap that they put at the bottom of every one of the codes. Like, if you want to know more about this code, you got to go buy this book for this year, or this book for this year, or that book for this year. And, you know, there's a whole other crap to buy if you want to see a full code descriptor. This is just the rationale for one cardiovascular code, and it'll go on for days. It tells you what's going on inside the surgery, step by step, what's going on, and, you know, that's kind of cool. They'll also sometimes give you, along with the rationale, a clinical example of how it would be coded. So, like, a 70-year-old female does this, this, and this, and here's a description of the procedure, and then they'll give you the rationale. So that's kind of cool. They just don't do that on every single code, but it'd be nice. But anyway, I need that book for that particular year to be able to see if they did something wrong there with that particular exam question, to fully know how the notes are done. Because every insurance company, even if I went to Blue Cross Blue Shield, they're not going to pay off minutes a certain way, and then neither is Cigna, and, you know, they'll all have their own way of billing that code. So health plans are no help with that kind of information anyway. All right, I'm going to get off here and go fix my kitchen back. But I hope this was helpful. Sorry I'm not more helpful with this particular code. I don't know. Maybe that time is wrong. Maybe it's right. Maybe it's the half plus the 1. But I'm wondering if it's because it's the crisis. If that's something to do with it being a crisis situation, that we don't have to wait the half. I don't know. And I wished it said right here. Use here to 74 minutes. It says it right there. Very interesting. Anything over 74 minutes would be just the one. But yeah. So I don't know if AAPC has their rationale wrong, then this question on their certification exam could be wrong too. Because like if they're picking this way of answering the question, everybody's getting it wrong if everybody knows this way of doing it. But then AAPC wants it this way answered. And that's what I find in some of their areas. I put down the rationale that they give me that they want for their answer. And teach it from their point of view, right? If that's their rationale, that's what they want on their answer. And I know up here it might say this, but if you're going to answer their question the way they want it answered, even if you're right, you're going to be wrong on exam day if this is the answer that they're looking for. And there's no way to tell them they have the answer to that question wrong because we don't get copies of our certification exam, right? And we can't audit the exam to know, hey, you actually got the wrong answer for this question. So it's always best to write it out the way they want it answered and answer it the way they want it answered. So I don't know. And I could always be doing this with this question, but then maybe they fix their rationale and maybe the answer to the question during the exam is correct with the correct rationale, and they only have out there the wrong question and the wrong practice exam question out there with the wrong answer, but the actual real exam has the right answer. I won't know. I have no idea because I can't audit their exams and y'all's answers to see what's right. Just based off of averages and how I was able to pass, I took their rationales and what they wanted for an answer and used that to pass, because I know if I used what I did in real life and health plans or medical groups or my jobs, policies and procedures on particular codes, we would have totally different answers. So, could be right, could be wrong. Either way, it's a mess. Happy Thanksgiving. I know. You're very welcome. I hope this all helps in one way, shape, or form. Don't stress too much. We could be 100% correct, and they want the 61 through 90 minutes for their exam, or you could be totally correct with the 74 minutes. I don't know what to tell you. My suspicion is we need the 61 to 91 minutes, or 90 minutes down, and that they have their exam question answered incorrectly on the certification exam. But it's only one question. We've got 99 other ones to worry about. And don't stress too hard. Like I said, there's going to be 15 questions on that exam. No matter what, we cannot get correct. It's the 85 other questions that I know we can find and have the correct answer for that we're worried about. Love you guys. I will see you guys on Friday.